Hello, welcome to Module 2, which is Level 2 Theories of Treatment of Sexual Offending. First, I have a few announcements. The book is in. The Ward book and the Saleh book are both in at the library, and they're working very hard to have the chapters scanned and posted to the website as soon as possible. So please check the website often so that when those chapters are posted, you'll be aware of that. And I'll try to send out an email as soon as I'm aware of that as well. Also, the lecture and discussion questions for both modules 2 and 3 have been posted. Like I mentioned in our first week, in our face-to-face meeting, I will be unavailable from February 2nd until February 9th, which is this coming Tuesday to the following Tuesday. So I've posted both lectures and discussion questions in advance. Also, you'll see in Module 2 that there is a discussion forum to write about your paper topics for the midterm paper and the final paper. Some have already posted what they'd like to have as their topic. For those of you who are undecided or have questions about that, please use the forum for that as well. And I'll review that and get back if there's any questions about choosing a topic or trying to find a subtopic within maybe a large topic that you're interested in. Also, I want to take the time to review your answers to the discussion questions from the first module. First, I wanted to mention that I know that some of you did not answer the discussion question 3, which we had discussed already in our face-to-face meeting. And that was not answered because the book was not in. So as soon as the chapters are published, what I'd like to see is that you can read those chapters and then respond to the third discussion question. Hopefully that can happen while we're still in Module 1. If not, that may have to be something that you'll go back and catch up on for Module 2. But for the first and second questions, everyone did a good job answering those, and it seemed like the answers were well thought out. For the first question, the what is deviant, how do you describe deviant? I noticed that many people mention personal, societal, cultural, and legal definitions in deciding what is deviant. One thing that I noticed that no one spoke about was religious influence, and that might be something to consider, and then also to consider in responding to others. And I do want to remind everyone to respond to at least 2 other students' questions by this Sunday. As far as the second discussion question, the personal thoughts about sex offenses, I also thought you did a good job answering those questions, and it seemed like everyone answered them honestly. It's definitely something to consider in all practice, clinical practice. So not just for sex offenders or for a population that you are maybe more aware that you may have some personal reaction, but with any clinical practice, with any clinical relationship, there's times when we do have those personal reactions. And we can talk about that in much more detail when we have the lecture and the discussion on countertransference. And again, just remember to comment on at least 2 other students' answers to those discussion questions by Sunday. So as far as Module 2, like I mentioned before, the topic is Level 2 Theories of Sex Offender Treatment. So just as a reminder, the first module spoke about Level 1 theories, which are multifactorial in nature. The Level 2 theories are single factor that are considered in understanding why sex offenses occur. So just to reiterate, Level 1 theories and Level 2 theories are trying to understand why sex offenses occur, whereas Level 3 theories and treatment models, which we'll cover in the next module, are trying to understand how sexual offenses occur. So again, Level 2 theories are looking at single factors when trying to determine and understand why sex offenses occur. There are more chapters that are covered in the assigned readings and in the lecture, so I encourage anyone who's interested in that to read beyond just the assigned chapters. But the 4 factors that we're going to focus on most are cognitive distortions, deficient victim empathy, deviant sexual preferences, and intimacy deficits. And the purpose for focusing more on those 4 are these are the 4 that are the most commonly discussed, the most commonly used in treatment, and the most widespread in the research. Each factor is defined and then described from differing perspectives. So that's something to keep mind of as you read through the chapters and also through the lecture. And I did want to make note that 2 of these 4 factors occur most often in treatment and are most widespread in the literature, and those are cognitive distortions and victim empathy. Again, those are the most researched variables and also the most widely used treatment targets. So you will see those come up in addition to all 4, but you'll see especially cognitive distortions and victim empathy come up often in the research and often throughout these chapters in the book, especially when talking about treatment and treatment models. And just as an interesting note, there is some disagreement about victim empathy in the literature, and it's actually pretty current, and it does affect especially assessment and looking at risk assessment. One side argues that there is lack of empathy is not related to increased recidivism. So having a lack of empathy statistically is not related to reoffending sexually. And so given that research, there's questions as to why it is still so heavily emphasized in treatment, which makes sense. If we're the purpose of treatment is to reduce recidivism, and we have a factor, lack of empathy, that's shown that there's no relation between having a lack of empathy and reoffending sexually, why would we still emphasize it so heavily in treatment? However, researchers on the other side suggest that empathy is so difficult to define and it's so difficult to measure that we really don't know its true influence or its true relationship to recidivism. So it is something that we should continue to consider in research and in treatment until we're able to measure or define that more specifically. But like I said, this is very much related to the risk assessment research, so we will discuss this in much more detail when we discuss sex offender recidivism and sex offender risk assessment, particularly talking about the Static 99 and the recent research updates for that. So this concludes the intro to Module 2. Please refer to the reading materials, the lecture, and the discussion questions, and feel free to email me with any questions. I do want to remind you that I am available until Tuesday night, Tuesday, February 2nd, and I will not be available again until Tuesday, February 9th. And I will be unavailable by phone or email because I am out of the country. However, Dr. Clark will be monitoring the discussion boards and will be available by email also if there's any specific questions that need to be answered during that time frame. So thank you and enjoy Module 2.